Good morning, respected chairperson, seniors, and my dear colleagues. On the onset, I'm grateful to the Afmrc committee for awarding my research work. Distraction osteogenesis, used to correct midface deficiency, brings about significant positional and tensional changes in the soft tissue envelope. The changes brought about by the distraction osteogenesis not only enhances aesthetics but also results in change in form and function. Advancement of maxilla brings about a statistically significant reciprocal changes in the pharyngeal airway space dimensions depending on the direction and magnitude of the skeletal movements. Warren et al. As early as in 1916 reported operated case of cleft lip palate having anatomical variation in pharyngeal airway space in terms of volume and nasal resistance, which was 20 to 30% higher than in non-cleft palate cases. The level of changes in the upper airway occurring three-dimensionally and its effect on the pre-existing veilopharyngeal insufficiency has always been subject of consideration in cleft lip palate cases. A few researchers suggest that there are no volumetric alterations that occur, but instead a compensatory expansion of the airway occurs, which grow laterally. The alteration of the upper airway structure in cleft lip palate patients is a widely debated and research topic with no consensus. Most studies have evaluated pharyngeal airway space with two-dimensional volumetric analysis of the lateral view films, which being two-dimensional are inaccurate to assess the airway volume volumetrically. The current study was conducted to assess the airway volumetrically in midface hypoplasia post-distraction osteogenesis using cone beam computed tomograph. Aim and objectives of the study was to evaluate the upper airway volumetrically in midface hypoplasia post-distraction osteogenesis using RED and its effect on the veilopharyngeal insufficiency. Volumetric changes were assessed at the nasopharynx and the oropharynx level, and objective evaluation of the veilopharyngeal insufficiency was carried out. The prospective study was conducted at Department of Oral and Maxillofacial Surgery in Army Dental Center (R&R). 12 cases of cleft lip and palate requiring advancement for midface hypoplasia using a rigid external distractor were selected after meeting inclusion and exclusion criteria. Out of 12 cases, 5 were male and 7 were female, with a mean age of 15.25 years and a reverse overjet greater than 7 mm. Here is a representative case of midface hypoplasia and a lateral cephalogram showing a severe maxillary deficiency with a midface hypoplasia with a reverse overjet greater than 7 mm. Pre-operatively, all selected patients had undergone pre-surgical orthodontics. Under general anesthesia, high-level stepped maxillary leaf open osteotomy was performed. Pterygoid disjunction was carried out with no attempt to down fracture the maxilla. A 4-root titanium mini plate was adapted on either side of the piriform aperture of the maxilla engaged with 26 gauge wire. Post-osteotomy, a latency period of 5 to 7 days was observed and wire was connected to distraction port. Distraction at rate of 0.5 mm 12 hourly for 7 to 12 days was carried out and a consolidation period of 8 to 10 weeks was observed. Image acquisition and data analysis. The technique described by Silicoglu et al. 2014 method was adopted to measure the pharyngeal airway space. The data was analyzed using the new NET technology software version 8.0. Evaluation was done at T1 pre-distraction, T2 immediate post-distraction, T3 1-year post-consolidation. All measurements were done by a single radiologist at specified intervals. Mean volume, minimum and maximum volumetric values and standard deviation was analyzed discretely. Objective analysis of veilopharyngeal insufficiency was carried out at T1, T2 and T3 intervals. Formulation of specific sentences completely devoid of nasal consonants as shown below were constructed. The sentences consisted of high pressure consonants P, P, T and K, low pressure consonants I and V and pressure sensitive consonants S and F were used. Individual data of the upper airway volume pre-operatively T1, consolidation phase T2 following distraction and 1-year post-distraction T3 were collated as shown in the table. The upper airway mean values were significantly different pre-operatively, post-operatively and 1 year post-operatively in nasopharyngeal and oropharyngeal region as shown. The oropharyngeal region T1 and T2 values notably differed. T2 value increased by 2.28 plus or minus 0.46 cm cube as shown in the table. The nasopharyngeal region T1 and T2 values were markedly different. T2 value increased by 4.28 plus or minus 1.68 centimeter cube, thus indicating a significant increase in the upper way, particularly in the nasopharyngeal region at the end of the distraction phase. Repeated measures of ANOVA used to compare volumetric changes at the pre-distraction, immediate post-distraction, and 1 year post-consolidation across the gender were not found to be statistically significant. Here's a table depicting the distribution of patient as per degree of hypernasality, range of maxillary distraction. At a maxillary advancement of 8 to 10 millimeter, there was 6 children who exhibited mild degree of hypernasality. At the advancement of 10 to 11 millimeter, there was 4 cases exhibiting moderate hypernasality, and cases where there was greater than 12 millimeter of advancement, there were 2 cases with severe hypernasality. Outcome of the studies are as under. The upper airway volume showed statistically significant increase with advancement of midphase in the range of 8 to 12 millimeter. A significant amount of relapse was noted in the nasopharyngeal and the oropharyngeal airway in the T3 phase. The advancement of maxilla not only brings a noticeable change in aesthetic and airway in all in 3 dimensions, in addition adds on to the pre-existing velopharyngeal insufficiency. Harda et al. In 2002 reported in a study maxillary distraction of less than 15 millimeter may not markedly affect velopharyngeal function in cleft patients. In our study, advancement of maxilla in the range of 8 to 12 millimeter showed a significant change in the velopharyngeal function. Out of 12 cases, 0.6 cases showed mild hypernasality, 0.4 cases moderate hypernasality, and 0.2 cases severe hypernasality was reported. In severe cases, a decline in speech intelligibility was noted at the end of the study. Conclusion. The study brings about the efficacy of rigid external distractor in severe midphase deficiency, highlights significant volumetric increase in the nasopharyngeal airway, particularly in nearly 3/4 of our subjects. Our results suggest CBCT as one of the important tools for diagnosis and treatment planning. The study also proves that hypernasality increases with severity of the defect. Our recommendations. Distraction osteogenesis is a time-tested procedure to advance midface region in left lip palate subjects with severe maxillary deficiency using the rigid external distractor. Presently, indigenous products are available in the market and are economical. The same has been used in the study with satisfactory results. CBCT is a reliable diagnostic and prognostic tool which reveals the precise change brought about by the rigid external distraction in airway volume, which may tend to affect the pre-existing velopharyngeal insufficiency. CLP cases should undergo preoperative objective evaluation to detect the presence of hypernasality, hyponasality, mixed nasality, which may deteriorate with maxillary advancement. I thank my teachers Brigadier Idiro and Colonel Vivek Saxena for their constant guidance and unflinching support during this project.